As a little girl, I loved going to the circus. My mom would get free tickets from her job for the whole family, and we'd all go. I still remember sneaking peeks through my squinted eyes, looking up at the tightrope walkers. They were so high in the air. The thrill, the danger, just one off step. Thinking back on that image from my childhood, the important truth of the matter was there was a net below, a safety net, if you will. Not obvious, almost invisible, but absolutely essential. Now contrast that with the flying Walendas. Does anybody remember them? They were the world-famous family tightrope act that performed without safety nets. And over the decades, this family has endured tragedy because without a net to catch them, their falls have resulted in serious injuries and multiple deaths. That's exactly what safety net hospitals provide. Not the main event, not in the spotlight, but catching people when they fall, saving them from illness, injury, and death every single day. But right now, that net is fraying, and that should be of concern to all of us. Now, before I lose the metaphor, let me tell you what a safety net hospital is. Safety net hospitals care for the people that other hospitals don't or won't. They care for the poor and the vulnerable and the uninsured and the underinsured, the Medicaid patients. Only 5% of hospitals in the US are considered safety net hospitals, but it is those 5% that provide 28% of all the charity or free care in this country. I know a little something about these safety net hospitals. I've worked in healthcare for 30 years. I've served as a doctor on the front lines in vulnerable communities, and I run safety net hospitals in Chicago. I've seen them up close, but not everybody has, because when most people think about hospitals, they imagine the obvious. Big, beautiful buildings with gleaming glass towers and soaring atriums with art installations. That's what people see because they're designed to be seen. They're the main attraction, if you will, like the tightrope walkers. And just like at the circus, many never even notice that net below, those safety net hospitals. But I'm here to tell you that safety net hospitals are a critical part of our healthcare ecosystem, and we need to see them and recognize what they do, because we will surely all notice if the net goes away. Whether it's emergency care or primary care or behavioral health, all the invisible threads that keep people tethered to health with preventive checkups and cancer screenings. We're often the trauma center where people come in at their lowest and most precarious moments. And at the same time, safety net hospitals are ushering in new life, delivering babies, and seeing families at their start. You might be asking, well, why do we need a net? We need a net because access to healthcare in this country looks like a two-tiered system. It's separate and unequal, with haves and have-nots. But safety nets say yes when others say no and you have nowhere else to go. But even still, safety nets are always strapped for cash because of a system that inadequately reimburses for the care of the poor. Reimburses at a rate that actually doesn't cover the cost. But still, every day, we fulfill that mission of care, and we provide that net, and we audaciously declare that healthcare is a right for everyone and not just a privilege for a few. Imagine an expectant mother about to deliver her baby, maybe by C-section at a safety net hospital, and another across town. Same procedure, same clinical training of all the doctors, same licenses held by the nurses, but not the same reimbursement. The safety net hospital is likely to get reimbursed anywhere from 40% to 100% less because of that patient's Medicaid insurance or complete lack of coverage. That gap to the safety net hospital, it's devastating. That underpayment means chronically deferred maintenance to the hospital. It means the mammogram machine isn't the latest 3D technology. It means excessive wait times because of overly lean staffing. Safety net hospitals often exist in neighborhoods that well-resourced hospitals won't touch because there's mission and then there's mathematics. And the mission is not supported by the math. With the lower reimbursement, there's no return on investment. Let that seep in. People who need care the most likely live in areas where hospitals are least likely to invest. And so that means that care looks different when it shouldn't. Diabetes doesn't look or feel different on me because I'm a Medicaid recipient, so why should the care look different compared to someone with private insurance? Several years ago, minutes before I was going to go on stage for a talk, my phone vibrated. I had 4 kids in 4 different schools, but I recognized the number as being from my youngest middle school. I immediately answered and heard the nurse saying, "Your daughter is having the worst headache of her life. She is not answering questions coherently. She can't even articulate where she is." My heart dropped into my stomach as I started thinking about all the worst case scenarios. And I was over an hour's drive away from the school. I said, "Nurse, please just call an ambulance and get my baby to the nearest hospital." All of my thoughts were centered on my baby's health and safety, as it should have been. And thankfully, after the CAT scan and the neurologic test, it turned out it was just a migraine headache and not a brain bleed or worse. But later, in a calmer moment, I was thinking about other families who might also need care. What if, instead of being solely focused on your loved one's health, you had to think about insurance or lack thereof, and can you afford the CAT scan or any of the other healthcare needs? Do we really want a system that's solely based on a wallet biopsy, that looks at your insurance coverage first and then delivers care based on how the hospital will be reimbursed? Don't we want everyone to have the best available care for their condition? Doesn't everyone deserve that? You're probably saying, yeah, there's an issue, but what am I supposed to do? So just go back and think about the places where you get care. When you're sick, you go to the doctor. If you're very sick, you go to the emergency room, right? Pretty straightforward. But what if it wasn't? What if all the patients from the safety net hospital now come to your hospital, and in your time of need, you're waiting 36 hours to be seen? Or what if mom needs hip surgery, and you help schedule the date because you're going to fly into town to be there on the day of surgery. And then the day of surgery comes and the surgery doesn't happen. Why? Because the safety net hospital had to make cuts, and it closed its trauma center. And so now all the cases that went there now come to your mom's hospital. And on the day of surgery, that increased load of emergency cases took priority in the operating rooms before your mom's elective surgery. And so now mom has to wait that much longer to be out of pain. Or what if you lose your job, you're laid off, and then you lose your employer-based insurance. Or you're young adult out there on their own trying to find their way, and then they turn 26 and they get kicked off of the parents' insurance plan. With all of those what ifs, healthcare is not so straightforward, and you could find yourself out on the tightrope, hoping there's a net to catch you. It's dangerous for all of us, whether it's the emergency room being overcrowded, or your mom's surgery being delayed. Everyone will feel the effects of a safety net hospital curbing services or closing altogether. It doesn't just harm the poor, it weakens the whole system. So when that seemingly invisible net disappears, the effects won't stay invisible for long. Let's go back inside the big top. You know, our healthcare system has been described as a bit of a circus sometimes, a spectacle, if you will, with all kinds of oddities and complexities. But I'm asking you not to just marvel at the tightrope walkers, but take a moment and see and appreciate the net below. The value of a healthcare system is ensuring that everyone has a place to land if or when they fall. And access to healthcare at hospitals, it's not a gated community. All of our access is interwoven. Yours, mine, all of ours. And healthcare is not about the hospitals. It's about people. So I'm asking you to look beyond the gleaming glass towers and look deeper under the surface. See the people in those old hospital buildings that are getting the care they so desperately need. See the people in the form of the mission-driven doctors and nurses passionate about serving the vulnerable communities. These are the images that should define healthcare. Because if we really care about more than just ourselves, and we care about the greater community, and we care about health justice, then we must care about safety net hospitals. I'm begging you, please, don't wait until the net vanishes to recognize that it was ever there. That will be too late. Now is the time to see them and support them and fund them appropriately before the fall. Because in the end, the question isn't, can we afford to support these safety net hospitals? The real question is, can we afford not to?